This year, the annual meeting of the International Academy for Clinical Hematology will take place between the 1st and 3rd of October 2020 in a digital manner. Unfortunately, because of the COVID-19 pandemic, we were obliged to cancel the in-person meeting, and hopefully we'll be able as soon as possible to go back to these in-person and warm interactions. So the meeting for this year is focused on acute leukemia, because the treatment and pathophysiological understanding of acute leukemia is really moving rapidly. For several decades, we had a sort of a stagnation, and over the last 4 or 5 years, we have seen the advent of many novel drugs, thanks also to the molecular biology techniques, but also NGS, which are allowing to further refine the diagnosis and to dissect the different leukemia entities. So it can take me hours and hours to speak about all of these novel agents being introduced, whether as part of the induction regimen, in combination with the conventional chemotherapy, but also as an alternative to the conventional chemotherapies. But also these novel agents are being used for consolidation and in many patients for a continuous therapy. They are, of course, also used at time of relapse. However, we must acknowledge that despite these progresses, we still have many acute leukemia, acute myeloid leukemia patients who relapse, who are primary refractory. And for these patients, allogeneic stem cell transplantation remains the only valid, I would say, option with some efficacy and some hope for cure. This is why the practice of allogeneic stem cell transplantation in patients with refractory AML is growing rapidly worldwide. And actually, the novel drugs can serve as a bridge to allotransplant, and they are also used for consolidation, for maintenance after transplantation. And this is now becoming quite widely spread in this field, bringing lots of hope for these patients who are really in a very, we consider in a high unmet medical need.